moving on to the next topic.
For the next session, I would like to invite Dr. Raveendra M., consultant physician and diabetologist at Gleneagles Hospital, Bengaluru, Vice President API, and Dr. P.S. Badri, consultant physician and diabetologist at Manjunatha Cardiac Clinic, Gauri Vidnur. We welcome you all, doctors.
Good evening, everyone. At the outset, my sincere thanks to Disha team, Dr. Manohar, for giving us this opportunity. I think nowadays people are getting more and more aware about a lot of medical things. So more and more medical-legal issues also coming up. Now here with us we have one of the expert speaker in this medical-legal issues. So Dr. K. Raveendra, he was the first president of chairman of APA Karnataka, and also most popular teacher among the postgraduates and most popular person among in the Bangalore Medical College, liked by postgraduates as well as his colleagues from other departments also. So I hand over the mic to Dr. Raveendra.
Before sir starts, there is an AI workshop which is going to happen in the Hall B. Interested people can be there. And if you want to enjoy and learn, then please stay here.
Thank you, Dr. Raveendra and my friend, for your great introduction. Thank you, Manohar, for the nice topic selection. Most of us doctors, we discuss so much of drugs, diseases, patients, everything. Rarely we discuss among ourselves. No Harrison textbook of medicine or API textbook of medicine describes how to protect your life, how not to go to jail, how not to be committed, how not to be get killed. Nobody will tell us. Practically, there is no protection. So unfortunately, we are seeing the most negative points today, especially in India. So these are one actually. So when there is a state conference in Hubli, if I am not wrong, 2 doctors in boarding hospitals were hit, admitted in that hospital. But minister was there in Hubli. No single sentence, no strike. Life continued, conference continued, next patient got treatment. You hit an auto driver today, what will happen tomorrow? You attack on BTS bus today, tomorrow what will happen? This is unfortunate. Doctors are highly not united actually, and the results are plenty actually. So death of a newborn, doctor gets 1 year jail. If a newborn dies, the doctor is arrested. If something goes wrong, doctor is the easiest target to get arrested actually. So mob vandalism, hospital assault suffers, okay, just 2 or 3. 2 doctors and 1 nurse suspended after rat bite patient in government ICU. Small examples I am giving. So every day I open the newspaper, there is something against the doctor. This is very unfortunate. Doctors are under stress. Take home message, doctors are dying early compared to human normal public. The problem of today is patients are getting educated, rather half educated. Single patient, multiple consultants, too much of subspecialization. Google.com has spoiled. False advertisements, high expectation from patient side, lack of faith, and a lot of problems from everywhere. This is a battlefield. Your consultation chamber in the hospital, don't think it is a great event. It is a battle between doctor and the patient when it comes to simple sentence. So now you have to fight against everybody, patient, relatives, media, government, what not, including your other doctors. So what is the problem right now is either a medical error or a medical negligence. To put it in a single way, whatever the mistakes we do without thinking, wrong decision, wrong diagnosis, wrong treatment, wrong execution of a skill is a medical error. Anything and everything of medical error can become medical negligence. Say for example, in ICU hospital where ICU bed is not good, medical negligence. Blood transfusion not given immediately, medical negligence. Staff nurse is not good, medical negligence. But when it diagnoses, wrong diagnosis, not thinking of a COVID disease during COVID pandemic is a medical error. Not doing the correct method of surgery, medical error. Not choosing the right drug for right patient at right time is a medical error. Simple examples for medical error and medical negligence. So, one simple example. If you prescribe a AC inhibitor for a pregnant woman, it becomes a medical error. If this error becomes a complication of the pregnancy, then becomes a negligence. Who will decide? A third person will decide, most important. Judge is not a doctor, most important. It is a judge who gives the punishment for you. He is a non-doctor. All of you should give your evidence, that's all. But judge will give you punishment. Judge is based upon facts and figures. But his documentation is very important. Most important, if you are a medicine man, read your textbook. What is a textbook? Harrison book, for example. So I'll give an example where you have to follow your textbook. Nothing more than that, nothing less than that, okay? The problems is very plenty. Why these medical errors occurring so fast in this country? All of us know poor knowledge, poor clinical skills, poor plan, poor communication. All of you know how many colleges, medical colleges are there in Bangalore? More than 12. There are only 2 colleges, BMC and St. John's, around 30 to 40 years back. Everybody is becoming a doctor. All Tom, Dick and Harry are becoming doctors. Non-doctors practicing so many. Everybody is a doctor in this country. Let us be very honest. And Government of India want to open college in ground floor on college, first floor on medical college. Successive government successfully spoiled medical education. Who is to be blamed? Every one of us. All parents want their kids to become doctors, whether they are interested or not, whether their performance good or bad. Ultimately, problems are poor knowledge, poor skill, deficiency in education. How many colleges have got professors? How many are teaching? How many OBG consultant has done surgeries before coming to, after taking MS degree? Very poor. And beautifully, one plus point is, there is no audit system in our country so far. In Dubai you go, in America, UK and all, let us say if I see 1,000 patients, Raveendra KR has seen 1,000 patients this month. Audit, patient number 111, patient number 386, patient number 933. Take, audit, and they will see. Any problems? 5 mistakes in a year, I think they are decided, gross mistake, minimum mistake, etc. So you are out of practice. So thankfully, we don't have the audit system. That's the one plus point in this country. So a lot of things, it may be in diagnosis. Physicians are often blamed for diagnosis. OPD consultation. Surgeons are often blamed for surgery portion and not writing the document and post-operative care. Surgeons are often caught in the post-operative care. So I'll just give one good example where one can go wrong. Okay? One patient, consultation number 1, a young software engineer presented to physician with fever, night sweat and fatigue of 1 week duration. You got a multi-nursing home. Lady physician examines the patient, prescribes antibiotic for 5 days, like any one of us. No investigations done. Consultation number 1 over. When the patient came for second consultation, 5 days, okay, after 5 days, no relief of symptom. He came back. Persistent fever, evening rise of temperature, night sweats and progressive fatigue. The famous physician examined the patient, did not find any localizing signs. Now she prescribed another course of antibiotic. Normally, you take azithromycin for 5 days, no improvement, switch over to augmentin. Very simple we do, regularly we do. No investigation ordered or done. Consultation number 3. Patient came back after 2 months. Persistent of fever, evening, night sweats, weight loss and neck swelling. Now the extra is evening rise of temperature and neck swelling. The same physician examined the patient and looked for the lymph nodes. Routine investigations were ordered, working diagnosis was made. The diagnosis was cervical lymphadenitis. Okay, maybe or to rule out TB lymphadenitis. Now she referred the patient for FNAC to the surgeon of the same hospital. The surgeon in the same hospital examined the patient and FNAC was done. FNAC report after came 2 days, as usual, so many we see, specific, non-specific, chronic inflammatory changes. The surgeon referred the patient back to the physician. Physician started anti-tubercular treatment, ATT. So now consultation number 4, 4th visit. The patient returned after 6 weeks with mild fever, jaundice, fatigue and multiple. What happened? Now jaundice has appeared. Second, number of swellings have increased. The same physician examined the patient and noted few more lymph nodes diagnosed ATT-induced hepatitis and stopped ATT after deranged LFT. LFT was done, deranged LFT, stop ATT, we'll see. She advised conservative management and follow up with fresh LFT reports. Consultation number 5. After 2 weeks, jaundice reduced. And the patient visited another hospital due to persistent. Number of swellings have increased, lymph node swellings. The physician in that hospital, next hospital, asked for a lymph node biopsy. Lymph node biopsy now showed Hodgkin's lymphoma. And the patient was referred to oncologist, started treatment for next 8 months or something like that, treated, patient symptomatically better. And the patient has recovered, now asymptomatic after 8 months of treatment. The patient has now patient has come back, software engineer, youngster, working for lakhs of rupees. Now he comes and sued the first physician, first surgeon, first hospital in the state consumer court. What is the complaint? Wrong diagnosis, wrong treatment, wrong procedure, complication of treatment, and a compensation for loss of how many? 1 year, nearly 1 year of compensation, work loss, and because of stress and mental agony. So now it has come to consumer court. It has gone out of doctors. Now you are out of doctor, okay? Consumer court. Questions for physician. What are the questions asked? Why were the investigation not done in the beginning? So tomorrow when you see a patient, don't prescribe antibiotic. Immediately don't write antibiotic. So why were the investigation not done? How did you arrive at a TB lymphadenitis? What is the diagnostic point for TB lymphadenitis? Why LFT done, not done during ATT? Harrison textbook mentioned LFT should be done before starting ATT. That one sentence. He quoted the sentence. Your book says LFT should be done. Question for surgeon. Why lymph node biopsy was not done? Why is FNAC enough for a diagnosis? So observation at state consumer court. The physician did not investigate the patient. These are the remarks done by the court, consumer court. The physician did not investigate the patient properly in the beginning. ATT was started in a hurry. LFT was not done before starting ATT. Lymph node biopsy was not done in the beginning. They are not referred to the oncologist at multiple lymph node swellings at the beginning. Not followed up the patient regularly. State consumer court judgment, both the physician and surgeon were negligent in this case. A compensation of 15 lakhs plus oncologist treatment expenses has to be borne. The doctors appealed to Central Consumer Court. Now it's easy. It has gone to the Delhi Central Consumer Court. Case was discussed, analyzed, same judgment was passed. Compensation now reduced from 15 lakhs to 10 lakhs. I mean, it's only 15 lakhs. Oncologist treatment was deducted. 10 lakhs for physician and 5 lakhs for surgeon. At this time, when I was the medical board chairman at Victoria Hospital for 7 long years, this case came to me at this stage. When I inquired, they asked me what to do, whether to fight the case The doctors want to appeal to the Supreme Court. The opinion was sought by the doctors from the experts. Doctor's advocate want to fight the case. Said advocate has to fight because he has to leave. LIVE. So then I said, sir, 15 lakhs is nothing for both of you. Please give 15 lakhs. Say goodbye for the case. Take rest and start fresh treat. So that is the one case. Another 3-4 minutes. Second case, OBG and medicine. Okay, another 5-6 slides, very important. A young female on treatment with an OBG consultant at a premier hospital came for first pregnancy, precious pregnancy, underwent LSCS, mother and baby healthy on day 1. This happened at day 3 night. Patient developed sudden onset of breathlessness for 2 hours and was sent by duty doctor. So duty doctor, also an MD OBG, very important. Duty doctor is also MD OBG, take home message, at 9:30 p.m. So sister telling information at 9:30. Duty doctor informed the consultant on the phone and started emergency treatment like oxygen. ECG was done. Sinus tachycardia was the answer. Other emergency line of treatment. But breathlessness did not improve. It worsened. Physician opinion was taken for further investigations were ordered. OBG consultant, the person who did LSCS, came at 11:30 in the midnight and shifted the patient to major hospital for need of ventilator support in a Maruti van cum ambulance. Repeat, Maruti van cum ambulance. So many hospitals have them. The duty doctor accompanied the patient. Very important. I have darkened the things which are meant to be seen in the court. The patient was hospitalized, intubated, protocol treatment was followed in that hospital. However, patient expired within 24 hours of hospitalization in the new hospital. The patient relatives sued the first doctor, duty doctor, OBG consultant, and the first hospital with the criminal negligence in the High Court. They say it's a criminal negligence. there in the High Court. High Court referred the case to State Medical Board and Consumer Court. After a brief and formal inquiry, the Medical Council, Karnataka Medical Council immediately suspended the doctor, not to practice for next 6 months. Don't practice for next 6 months. And the case was referred, then came to Consumer Court. Observation at Consumer Court. See, very important, where we went wrong. Incompetence. Consumer Court said, incompetence of the duty doctor to recognize the medical emergency. Poor hospital ambulance services. You are referred in a simple Maruti van, okay? Lack of ICU in the hospital. Negligence of the staff nurse to inform consultant and the physician 2 hours delay. The patient was complaining of acute onset of breathlessness at 6 p.m. Nurse informed the doctor at 8 p.m. Doctor saw the patient at 9:30. Consultant came at 11:30. Shifted the patient at midnight 3 o'clock. See, every hour, every minute, okay, they noted. Opinion Medical Board. So then they referred. From the Consumer Court, it came to me, Victoria Hospital, Medical Board. I wrote, because we have to protect our doctors, basically, okay? So I wrote beautifully. Antenatal pregnancy care was adequate. Indications for LSCS was appropriate. 1 2 minutes. LSCS was done on protocol basis. Immediate post-operative care was uneventful. Duty doctor attended the case on time. Immediate line of treatment was given. Duty doctor accompanied the patient to the ambulance. Physician and OBG consultant informed. There is no direct negligence from our doctor's side, because duty doctor came. He was informed late. He came. He saw. He started treatment. Informed other doctors. Send the patient to other hospital. ICU care. So there is no negligence. Post-mortem report came. It was a cause of death because of amniotic fluid embolism. So I gave a report. That report also came in the Consumer Court. After Medical Board opinion and PM report, no direct medical negligence was found by the doctor. This is the Consumer Court. What are the points in favor? Duty doctor came on time. Duty doctor is not a simple doctor. He is a MD OBG doctor. Very important. Informed the consultant on time. Immediate treatment given. Accompanied. Very important. Here is a doctor who accompanied the patient to the court. And the State Medical Council revoked the consent. Immediately after this report of mine, on the post-mortem report, that State Medical Board revoked the suspension. And what next? Case to continue in the Consumer Court. So mostly they give compensation. I think message is very clear actually. You have to involve with the patient. Don't your relatives or that relative or my friend, so don't bill anybody. You are a doctor, others is a patient, that's all. In the consultation chamber, you are sitting, patient is sitting. Please write, document everything. Otherwise, there is no person can help you. Follow the Harrison textbook of medicine if you are an internal medicine, internal medicine consultant. No, nothing more than that. Update yourself. Otherwise, very difficult. Every pinpoint they will ask you. I think I've got 100 court orders saying that you are wrong here, you are wrong here, you are wrong here. I don't know what to say. Concentrate on single individual. Listen and discuss with patient and relatives. Go through the past records. Consider different PGs if you are there. Consider differential diagnosis before you arrive at a single diagnosis. Do not step into other specialty. Don't treat OBG. Don't treat a surgical case in medical ward. It is not your field. Treat emergencies first. Insure yourself against, most important, all of you should insure at least up to a physician up to 40 to 50 lakh, surgeon, OBG people, anesthesia people up to 1 crore. Special care in handling, in special groups. Do not prescribe without seeing the patient. Lot of things are happening. Record all happening. Please document everything. 2 minutes. So there are a lot of questions which are not answered now. Every day we do mistakes. Every day we do. Employment of Ayush doctors in hospital, the bridge course, the telephone consultation, telepathy, referring for no reason, single specialty versus multi-specialty patient, ethics in general research, clinical trials, generic drugs, medicine is changing. Won't tell you, generic drugs, government generic, what is that called? Generic, Janaushadhi, etc. Who is responsible? Quality of the drug. Is paracetamol 650? Contains 650? Is it paracetamol first? What happened to Chintamani eye camp when 32 or 17 people lost blinded because they advised ciprofloxacin eye drops. Eye drops contained metformin. Long back, 20, 30 years back. Chintamani eye camp, famous. See, I give eye drop after surgery. It should be antibiotic. Let us say it is a distilled water. Who is controlling this quality in this country? Where is the quality? Whether I can write only Dolo 650, paracetamol 650. Whether I know it is paracetamol? Who knows? So there are a lot of things actually because of lack of quality actually, okay? Too much is too bad. The actual problem is expectation is too much from patient side. They don't know the exact reality. And remember most important things, whatever the case, whatever it is, the only thing which comes to your support is one, whatever the documents you have made. And latest, what textbook you have followed, very important. You cannot write whatever you want, what textbook you want, okay? Very important. Law is a slave of evidence and document is the most important. Therefore, the only thing left for you is document. So document the communication you have made, communicate the documents you have made, 2 important points to escape from the legal suits, etc. Remember, a lot of people are waiting. Second opinion, they come. Third opinion, fourth opinion. Please write on the case sheet, black and white. Put time and date. Put your sign and seal. This is, on that day I have taken the correct decision. This is my decision. Hyperkalemia is the thing. Hyperkalemia. At midnight, 2 o'clock, advise this treatment. Yes, I am responsible for this. So that should be your spirit. Otherwise, difficult. Nobody will save you. Okay? I think please put this in all your clinics and hospitals, okay? Indian Penal Code, where other problems will, okay? So, save yourself before you save others. Life is very difficult, not easy to practice actually. So, once you get in, then you know, wow, just like driving in Bangalore roads. Thank you for the opportunity. Thank you very much, sir. Thanks.
Thank you, sir. It was an excellent presentation with examples of what to do, what not to do, how to document and how to safeguard yourselves and how to be abreast with the latest knowledge and how to be careful about not committing mistakes. It's a lesson for everybody who practices each and every day. We have to be very careful. That's your message. Thank you, sir. Thank you.
Thank you so much, doctors. We request the chairpersons and speaker to move towards the selfie area for the group photo.